Earlier, Johns Hopkins University senior scholar Amesh Adalja was on Bloomberg TV to discuss how this could impact that it may have on the pandemic recovery.
I don't think we know the answer to that right now. We know that all viruses mutate and that this mutation seems to be very prevalent in parts of England. And there is some association in laboratory studies about this transmitting more easily. We don't know if that's what's going on in the real world. I think it's hard to make sometimes that leap from what happens in a lab to what's happening in real life. And there could be other causes for why this has become dominant. But even if it is more transmissible, that doesn't change what we do. It still means that social distancing, wearing masks, washing your hands, trying to avoid crowded and congregated places, that's the way that you beat this and any other coronavirus strain. The other issue is, there's no evidence that this is going to decrease the efficacy of the vaccines, and they're doing studies right now, Moderna and Pfizer, to see whether or not their vaccine is robust against this. I think that it's going to prove to be so. Vaccines induce a whole host of different antibodies, and it's not just one type of mutation. It takes a while to be able to evade a vaccine. So I don't think that this changes anything, although there is a lot of concern and we need to get some answers on it. We still should not panic about it.
It feels like deja vu all over again, to quote Yogi Berra, when we look at the travel bans that are going into place and then the questions around the efficacy of banning travel after probably the cat's out of the bag and the virus has already spread. What is the efficacy of some of these orders?
Zero. I don't think that you're going to see any efficacy from these travel bans, because you have to remember that England and a few other countries do a lot of sequencing. Not many countries do sequencing of the virus. So there's nothing to say that this strain isn't already in other countries. And these travel bans are really going to be ineffectual, cause more disruption, stigmatize England. And even those travel bans around London, when they were announced, forced people to kind of leave London ahead of time, and that probably caused more spread of COVID-19 to other parts of London because people were panicked and left. So travel bans are not the answer to this, and I think that it's unfortunate that that's this blunt tool that politicians always run to instead of actually taking a nuanced scientific approach, but they often don't want to wait for the answers and prefer action rather than to actually thinking.
You don't say. Shocking about the political sphere. I am wondering, you did get your vaccine on Friday. You say that you're doing well. I'm curious how your behavior, your personal behavior will change, just to use as a model for others who may get the vaccine at some point in the future once you are fully inoculated from the virus.
It won't change very much because we know that this vaccine is very efficacious at preventing you from getting symptomatic disease. We don't quite know yet if you can get asymptomatic disease and can you spread that virus that you might acquire even though you have the vaccine to someone that's vulnerable. So I need to see more data on that before I would change my behavior substantially. But I'm going to be able to take care of patients in a much more confident manner because I know that I'm not going to be someone who gets severe disease. And I think it's also something important that we see that this vaccine is the solution to this pandemic, and the more people that get it when their time is called, the better.
Will we have an answer to the infectious aspect once we get the vaccine, that question in the near term?
We should, because you can look at the breakthrough infections that occur in vaccinated people and then sequence the virus and say, is it any different? We know it's 95% efficacious, but in that 5% of people who get vaccinated and still get the disease, is the virus the same or does this have the mutation in it? So this is a question that's answerable, and I think we will have answers very soon.
That was Johns Hopkins University senior scholar Amesh Adalja. The Johns Hopkins Bloomberg School of Public Health is supported by Michael R. Bloomberg, founder of Bloomberg LP and Bloomberg Philanthropies.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quicktake now for insight in an instant.